everybody who's joining us. And good morning to those who may be based elsewhere. My name is Greg Perry. I'm the Director General here at the Global Self-Care Federation, and I'm welcoming you all to this webinar on transitioning patient information from print to pixels. And this is an insight from South Africa. So as we know, e-labeling is a real key tool in a consumer-centric, tech-driven healthcare arena. And regions are progressing rapidly in this area. Now, we've estimated that there is some $4 billion saving by 2030 and 44 million hours in physical time savings in sub-Saharan Africa by the adoption and use of e-labeling. Now, through their OTC online directory, SAPRA have been championing delivery of information on non-prescription medicines digitally. And today's webinar seeks to show a number of things. We want to show the benefits of e-labeling from a patient-centric information point of view. We want to hear from regulators, pharmacists, and industry about moves and importance towards e-labeling. We want to examine existing practices in South Africa and insights into the Paper to Pixels pilot program. And then we will have a panel discussion. This, I should say, is a number of webinars that we are doing in the area of e-labeling. We are very committed to the concept of e-labeling. We see it as very much part of consumer or people-centric information in the healthcare sector, and of course, particularly important from the OTC side, where information from, for example, from the pharmacist and through the e-labeling is key for individuals. So I'm going to introduce our panel. Our panel consists of Luleka Dlamini, who is the Manager of Clinical Post-Registration at SAPRA. And we're then joined by my colleague Nicola Brink, who is CEO of the South African Association for Self-Care. We will then be joined by Momina Araji, and I do apologize for my pronunciation, who's Country Head of Scientific Affairs in South Africa at CFAO Healthcare. And then Jackie Maymin, who is the CEO of the Independent Community Pharmacy Association of South Africa. So I will hand over now to Luleka, who will run us through the e-labeling from the SAPRA perspective.
Thank you so much, Greg, and thank you to the attendees for participating in this webinar. As Greg has said, I'm Luleka Dlamini, and I am the Manager of Clinical Post-Registration within the South African Health Products Regulatory Authority. And I think we are seeing that there is digital transformation which is shaping our healthcare systems across the globe. And as regulators, we are exploring e-labeling as a tool to improve access to up-to-date medicine information. And in this, in the slides, we are then going to go through the opportunities and the responsibilities that come with modernizing patient information. And we'll also discuss the current initiatives that SAPRA is doing, and the regulatory considerations, as well as the practical implications of adopting e-labeling. And SAPRA's intention is to adopt e-labeling, and that we are doing because we want to align with best practices. And the aim is to facilitate smoother pharmaceutical trade and ensure future compliance with international standards. E-labeling is an electronic format of product information which can be accessible via the QR codes, the app, or a web, which is linked to our database as regulatory authorities. And it must be noted that we are a middle-income country, so there will be concerns regarding infrastructure and literacy. But in this presentation, we then explore why the benefits of e-labeling outweighs the barriers that currently exist, particularly in the South African context. SAPRA in recent years has prioritized digital transformation to enhance efficiency, agility, and innovation in our regulatory processes. Some of the key digital evolutions which we've implemented in recent years is the Regulatory Information Management Systems, popularly known as RIMS, within SAPRA, which is a platform to streamline regulatory processes, incorporate automation, intelligence, and robust reporting capabilities. With that, we've also implemented a self-service customer portals, which aims to improve stakeholder experience when accessing regulatory services. This is just an example of one of the platforms that we've implemented, which is the OTC medicine information, OTC meaning over-the-counter medicine, because currently this platform only exists for over-the-counter medicines. So in this platform is a patients-friendly platform where the public, patients, healthcare professionals can actually access information on medicines in real time. With the OTC phase was phase 1 of the project, and currently we are in the process of improving access to even prescription medicines. So phase 1 was only focusing on OTC medicines. Phase 2 will then focus on prescription medicines. Over the counter, the focus was between medicines scheduled between Schedule 0 and Schedule 2, whereas this prescription platform then will incorporate everything above Schedule 2. SAPRA aims to embrace e-labeling as part of its commitment to modernizing medicine regulation and enhancing accessibility. And this reflects our commitment to innovation, sustainability, and improved public healthcare outcomes. Why are we embracing e-labeling e-labeling for medicines in South Africa? It's because we do note that it enables rapid updates to the professional information and that then enhances patient safety and improves accessibility. With this, there's an opportunity to integrate with pharmacovigilance to ensure timely communication of risks to healthcare professionals and patients. And also, as I've previously mentioned, that the aim is to also align with global standards. And as you may or may not know, that SAPRA has gone digital with our dossiers. So when we embrace e-labeling, we then create a space where applicants are always ready for our digital dossiers. But over and above everything, it's the responsibility of being environmentally friendly and sustaining our environment. We do recognize that many patients, especially in rural settings in South Africa, have limited internet access and may struggle with digital platforms. And that's why it is important for us to design systems that work offline, that can support basic phones and leverage healthcare workers to support access. And that must be done to address the digital divide that exists in South Africa. And some of the proposals that we are looking at is having the apps or the uploads, web downloads of these e-labels to be zero rated so that patients can access these e-labels offline. With that, we are also looking at approaching this in a hybrid model. We have printed PIs, but still do digital. In that way, we are then able to gather data in terms of the usability of both the platforms and how far of a reach both these platforms have. And we should be looking at the use of healthcare professionals as information mediators, because these are the people that are on the ground interacting with patients on a daily basis. And we should be exploring SMS-based systems to translate safety information to patients and the public at large. These slides highlight SAPRA's commitment to a strategic and phased approach to e-labeling implementation. This is to enable SAPRA to build regulatory capacity, to mitigate risk, and ensure inclusivity throughout the rollout, particularly to vulnerable populations who rely on basic mobile access. In this pilot, SAPRA undertook to pilot select medicines with well-established safety profiles. In the pilot, we've defined the specific regions where the pilot is going to take place, the healthcare facilities, and the patient groups, because we want the pilot to be as inclusive as possible. However, this pilot is subject to the implementation of, the exemption, the granting of Section 36 exemption by SAPRA to the participating applicants. The participating applicants have submitted their request to be exempted from the section from the provisions of Regulation 10 and 12, and the regulator is still looking at that request so that we mitigate as much as possible the risk that we may anticipate throughout the pilot. And this approach for us to pilot the e-labeling in South Africa is so that we can evaluate real-world usability of e-labeling. Currently, we don't necessarily have data that gives us insights in terms of whether e-labeling is something that can be used within the South African context. Also, it helps us to identify and resolve technical or regulatory gaps. And it also helps us to gather evidence to support broader policy changes, because the e-labeling in its nature is not necessarily catered for in our regulations. So this pilot will then give us information for us to support regulation changes. And these are the companies that are going to be participating in the pilot as per the request that we've received from industry. So when we talk about inclusivity in e-labeling, we have to look beyond digital access alone. Language and literacy are just as crucial. And so as we may know, that South Africa has 12 official languages, with South African Sign Language being the most recent addition in 2023. To truly meet the needs of all our citizens, we believe that e-labeling solutions must also include linguistic diversity, which means we must offer these professional information in multiple languages, not just English alone, which is not necessarily a first language for many of our end users. And accessibility should not stop at just translating to the other languages, but we also have to look at literacy barriers, because we understand that not everyone can read a printed PI, or PIL, or even the digital label. And that's where we should be exploring multimedia approaches. And one powerful solution, we believe, is audio leaflets. And we believe that this pilot presents an opportunity for us to explore audio leaflets where users can actually listen to professional information in their own language via a mobile phone. And finally, I think it's important for us to pair these tools with awareness campaigns, targeting both healthcare providers and communities as the end users of these patient information leaflets. And through these layered multilingual and multimedia strategies, we can ensure that e-labeling is not just a digital convenience, but it is a tool towards equity and health empowerment. Thank you.
thank you so much, Luleka. And I just want to pick up a couple of points before we go on to Nicola. Well, firstly, obviously, congratulations to SAPRA from going digital in general. This pilot project clearly really critical, not just I think for South Africa, but also for the rest of us to see in the world. And obviously having its approval is key. I just like to underline the points that you mentioned at the end, which was about the issue about language. And it really is important that there is diversity in language for the end user. And I thought the points that you were mentioning about the audio leaflet and ensuring that barriers to literacy are brought down to ensure access and equity are really important. Another thing, but it's not for today, is looking maybe at the future at international symbols as well to help people guide them in being able to administer their medicines correctly. But that's for another time. It was really very interesting, and I'll hand over now to Nicola.
Thank you, Greg, and thank you, Luleka. So I'm going to be fairly brief. My name is Nicola Brink. As Greg mentioned, I'm the CEO of the Self-Care Association of South Africa, and I'm going to just briefly touch on challenges and how we have addressed them. But before I jump into that, I really want to highlight the role that SAPRA have played in all of this. If it wasn't for SAPRA's engaging attitude and being open to exploring digital and to moving ahead at a relatively fast pace, we wouldn't be where we are today. So a huge thank you to Luleka and her colleagues for all the work and the input that you have done to make this project and then the pilot a success. So one of the big questions that hung over us, and I think it still does, is, and Luleka highlighted it, is that not everybody has access to a smartphone, and not everybody has access to the internet. And certainly one of the barriers, which again Luleka has highlighted, is the need to zero rate the site, which means that the consumer does not need data to access the information. But relevant to this is, and worth noting, is that we have a population of 64.7 million in South Africa and 45.3 million, so that's just close on 75%, are in fact internet users, which is relatively high. And very interestingly is there are 118.6 million active cellular mobile connections in South Africa, which is equivalent to 195.4% of the population, which suggests obviously that several people have more than one SIM card or access, well, possibly even more than one phone. And 99.3% of internet users actually have a smartphone. And that in itself really helps us move this project forward. And Luleka also mentioned those who are illiterate. And in South Africa, 3.2 million people are deemed to be totally illiterate. That equates to 5%. So again, the audio that Luleka spoke to becomes really critical. Go to the next slide. Something that's also really worth noting is that our population age is very skewed towards the youth. The median age of South Africa's population is 27.7, and 30% of the population are actually under the age of 15. So again, we all know that the youngsters are particularly tech savvy, and certainly in the very near future, we're going to be in a space where this will be second nature. Whip out your phone, scan a QR code, and boom, the information will be right there. A further problem we had, and again, Luleka touched on this, is the fact that not many people, or not everybody's language is English. Having said that, currently one of the regulations for which industry is seeking a Section 36 exemption is to have 2 languages on pack, which is the current requirement. What we've proposed and what the exemption outlines is that in order to free up real estate on various packs, and this is the immediate container label that you see on your screen right now, you will note that going from 2 languages to 1 really allows us to put a lot of information on pack. And if you just take a moment to have a look at what you see on screen, you'll see active ingredients, dosage and direction for use, specific warnings, etc., as well as space for a QR code and to ask the consumer to scan the code in question. And if you move to the next slide, you will see an example of the outer label, which again provides significantly more information that we currently are able to put on a outer label, bearing in mind that currently the requirement is 2 languages. And if you have it move to the next slide, you will see again a different view of the outer label. So this is very, very important for the pilot to have all of this information on pack, so that if the consumer is unable for whatever reason to scan the QR code and get the full information, there is enough information on pack for the consumer to safely take the medicine in question. Then if we can have another, moving on to the next slide, this is an example of an analgesic in South Africa, and it comes in a small sachet and in a powder format. And this is probably the smallest format that we have on sale in South Africa. And therefore, it was really important for us to be able to use this as a test case to see if we could put all the information that is necessary onto this small sachet. And we were successfully able to do that and also incorporate the QR code, which once is scanned, is able to access the information in question. And then one last issue for us was, do we go QR code or do we go GS1 code? And you're all familiar with GS1. It's a universal code. And there were a lot of reasons to try and incorporate the GS1 code into the pilot as opposed to the QR code. But our research tells us that that's a bridge too far at this point. So we made the decision together with SAHPRA's input to stick with a QR code, and for the foreseeable future, that is the route that we will be going. And those are all really the challenges that we've had. So we've been very, very fortunate that there haven't been that many. I'm sure a few more will crop up as we walk this journey. But together as a team, I'm pretty sure that we'll be able to address those. So thank you very much.
Okay, thank you so much, Nicola. Some amazing figures out there that you've put, which are very interesting. Many issues quite specific to the sub-Saharan region, and it is really great to hear the work of the agency together with yourselves, and also highlighting here some of the obviously very strong practical problems or challenges, let's say, around the packaging issue. So we're going to move over now to Momina. The floor is yours.
Thanks so much, Greg. Good afternoon, everybody. I think my job today is quite easy, is to walk you through the practical implementation side of the e-labeling initiative, kind of focusing specifically on how companies can plug into the database, but also of what do we need to consider operationally. And so, I mean, the first slide is, this is the QR code. And if you can scan that code and it will take you to the portal that we're going to look at now. But this is an example of what patients or healthcare professionals would see on pack or on the promotional material itself. And this QR code is then generated via the online portal, and it links directly to a dedicated product landing page. And Obviously, there's a portal where you can put in the name of the product as well, or the name of the API as well. That will then take you to that specific landing page. It's really important to note that the QR code, it's not generated by companies, but it is generated via the digital platform. So it is generated in the back end, by SAPRA. And obviously, this then ensures the standardization and the traceability, as well as reducing the duplication across the manufacturers. But it also alleviates a big burden from industry. So you don't have to develop this on your own in your own systems or invest in a separate digital interface. It is done via this particular platform. And so when you scan that, it then takes you to the portal. And this is then, if you could go to the next slide, it gives you a visual representation of what the end user is going to see, whether you're a patient, a caregiver, or a healthcare professional. This is what you'll see when you scan the QR code on the pack. And so as you see, there's the name of the product, there's the API, it's the dosing, it's how do you take it. In simple language, it's easily understandable by a consumer, but it's also understandable, obviously, then by the HCP. And this product landing page, as you can see with the green tabs, it hosts the approved PI and the pill in a format that is always up to date. It's accessible 24/7, and it's it's compliant with the latest regulatory version. It's designed to be simple, mobile friendly, secure. And this is obviously then to avoid unnecessary navigation or downloading, and you can get the document almost instantaneously. One of the main intentions, and I think Luleka touched on this as well, is to provide a single source of truth. So especially important when we think about the consistency across the distribution channels like pharmacies, hospitals, or wholesalers. We can always come back to this QR code and to this and this particular page, or the PIL and the pill, and we will get a single source of truth in terms of the use of the product and the dosage, and even the adverse events as well. For patients, it eliminates uncertainty. You don't lose the leaflets. You don't get a hard-to-read leaflet. As we age, our eyesight gets worse. We can't really read the small writing. For healthcare professionals, it ensures the access to the critical information during consultations or dispensing. It's really easy to just pick it up. And for companies, as industry, it centralizes the document control. So we're reducing printing errors, update delays, and compliance risks. And you know that's going to be your true source of information. Again, it's simple, it's clear, it's instant, it's accurate information, it's directly accessible to patients and then to healthcare professionals alike. The slide here on the holder of certificate of registration is responsible for the loading of the information. And it's important to clarify that the market authorization holder, the holder of certificate of registration, is legally responsible for uploading and maintaining the correct patient information. Even though upload is straightforward, you have to ensure that there's due diligence, so it remains essential. And the uploaded document must be the most current SAPRA-approved version of the particular PIL or pill. Internally, the company, the ATR, is expected to establish an SOP with checks and balances to ensure that you are then uploading the correct, current, and SAPRA-approved information on the website or on the portal. But to make this manageable for companies, there are several automated controls and supporting mechanisms built into the back end of the system. And this includes a mandatory declaration step by the responsible pharmacist, and the RP then must then actively confirm the accuracy of the information before it goes live. As we know, this reinforces patient safety, but it also ensures a strong audit trail and simplifies the compliance reviews down the line. There's no cost to access or use this platform. And I think Luleka touched on that as well, as zero rating, which makes it highly equitable, and especially for smaller and generic players as well. On the next slide, it's just a simple roadmap in terms of the key implementation steps for companies to follow. And so whether you're uploading it for the first time or managing updates, you have a structured internal process that should help reduce the compliance risk and ensures the readiness for any SAPRA audits. And if you look at it, it's registering the company on the portal, identifying the responsible personnel via the RP, via delegations, to develop and update SOPs, as I spoke to about uploading, to align the artwork timelines with the QR code generation, and then just make sure you are conducting your internal compliance checks every time you are doing an update on a particular portal. I mean, I've hammered on about compliance, and if you look at the next slide, we know that the regulatory tool compliance is key. While the platform is user-friendly, this responsibility remains with the RP and the holder of certificate of registration. Think of it as a live label. What's uploaded is immediately visible, obviously with the check in place, and therefore must be correct and current. And as I said again, the RP has to complete a declaration before this live update. To make implementation smoother, SAHPRA has created a central support channel, and you'll see it on the next slide, where a dedicated email is staffed 5 days a week to help manufacturers with questions, with industry with questions, with onboarding or any issues with uploading. The account setup is relatively easy. The association can assist if your company hasn't yet registered or activated on this particular portal. And importantly, it's open access. It's access to entire industry, not just specific association members, not just specific industry members. This is an industry-wide solution, and this is intended to benefit the public. The next two slides is just what we look at when we say it's the OTC and the prescription lock-ins. This should appear on promotional material on websites, and this is going to drive the consumer. It's going to drive the HCP to the portal, but it's also important for consumers and HCPs to access the information, again, from that single trusted source. So both the slides just speak to these are the lock-ins that should then be on the promotional materials and websites as well, if they are product-dedicated websites. What we have to understand is that e-labeling is going to open the door to patient-centered innovation. As we mature in this space, we can explore the layered content that sits behind it that may also evolve to host other elements in the future. Some of these are the multilingual pills hosted in a drop-down format, which we spoke about the languages. We have 11 national languages in South Africa. It then opens up that option as well. There's version control to see which pill or when the pill, was last updated, and potentially links to safety reporting or contact channels for adverse event queries. There could be voiceover explanations, audio in terms of certain disabilities. It could be symptom visualizers. There could even be analytics to measure how often the info is accessed. And so, I mean, I think we have to, there's also views and engagement. So there's the data analytics for tracking the views and engagement, which would then help for future stats as well, right? On how well the uptake of QR codes and electronic labeling by South Africa is. I think I have to say that this platform is more than just a compliance tool. I did say it before. It's a bridge to a more empowered patient, a better informed healthcare provider, and a digitally agile regulatory environment. As industry, with SAHPRA, with collaboration, we all have a part to play in building this future. It was designed to be both robust and practical, and with the right processes in place, implementation it's achievable, and it's insight, and it's a clear step forward in modernizing patient access to critical health information. So thank you very much. I hand it back over to you, Greg.
Yeah, Mamina, thank you very much. Just shows all the background to all of this that has to be done to get these e-labeling up and running. And I liked a couple of points you made. Industry-wide solution to benefit the consumer, and that this opens doors to innovation and essentially people empowerment. And I'm very interested there, and still up there, the future possibilities. So there is a lot that can be done, I think, to address concerns or create opportunities around much which was mentioned earlier on by Luleka. Okay, so finally I'm going to hand over to Jackie. The floor is yours.
Thanks very much, Greg. Yes. And I'm going to give the pharmacist's perspective on these e-leaflets. Next slide, please. So paper-based patient information leaflets, when they first came out, they had a number of benefits. The first was that it is relatively easy to understand instructions as opposed to the professional information leaflet. And as pharmacists, especially for pharmacist-initiated therapy or OTC medicines, it reinforces our counseling points. Next slide. The challenges, though, are that it's usually only in English. The print is so small that myself, I can no longer read some of these package inserts. By the time you've unfolded it, and very often the PIL is attached to the package insert, the writing is tiny. And this is very difficult for a lot of patients. The layout is complex. Very often they don't know where the PIL starts and where the package insert ends. The other issue is we find so often the mother or the caregiver or the patient gets the medicine home, they throw the box away, and the leaflets are in the box. Sometimes the leaflets are not attached to the medicine. So there are certain generic medicines where we may get 100 bottles and we get 100 leaflets separate. And then it's always like we've got to try and keep the leaflet with the medicine to hand it out to the patient. And then lastly, as pharmacists, we often repackage medicines. So we might have a bulk pack of something and a patient only requires 10. And now, in terms of the law, we need to give a PIL, which means trying to photostat it. And I can guarantee you none of the PILs are A4, and it's a huge challenge. Thank you. Next slide. So if we had to go electronic, and I've been listening to all of this, sorry, apologies for that. I've been listening to all of this. So let's have a look at the pros and cons. So on the positive side, the PIL will be easily accessible via this QR code. The font, so now if I do get it on my phone, I can make it big and I'll be able to read it. So the font can be increased. The information can be amended whenever there is a change. And I'm going to take you through a case study to show you why this is important. And there's also the option to have multiple translations. And what I found so fascinating is that you could actually have audio ones, because there are lots of disabled people. There are lots of people, I think, Nicola, you were saying that 5% of our population is illiterate. And this would be a wonderful innovation. And then on the con side is the fact that the person may need a smartphone and they require data. But I've also seen that you've got solutions to these. So I love the idea of the zero-rated or offline access, and the fact it can be done via a non-smartphone. Next slide, please. So I thought I'd take you through a case study, and this happened to a pharmacist recently. So we had a mother who had a cough syrup used for an older child in her cupboard. She's got a brand new baby, 6 weeks old, and it's got a cough. Now she knows that this cough mixture she had worked well for her older child. The PIL with the medicine had dosage, and the dosage is for infants. Now we all know that an infant is a child up to 1 year. So she has a look at this, and it says infants 2.5 mils, and you can give that 3 or 4 times a day. Now, this was a dextromethorphan-containing medicine, so it's a cough suppressant. And at 2 o'clock in the morning, she hasn't got anybody to ask. She relies on the information that is with the medicine. Now, SAHPRA, back in 2012, issued a safety alert, which, amongst other APIs, dextromethorphan should not be or is completely contraindicated in children under 2 years of age. And here's an example where a PIL has not been updated. And I would dearly hope, and I'm glad we've got SAHPRA on here today, that the PILs will be regularly updated, because here a very small baby was given a cough suppressant and we know the risks associated with that. Next slide, please. So what are the advantages for us as pharmacists? So very often with us as pharmacists as well, in a rush, somebody's requested a package insert or a PIL and we've given it out. And now we've got a container of medicine that no longer has any information with it. So this is now downloadable. We would also be able to possibly download and give to a patient. It means as pharmacists, we always have the latest information in front of us. I also think improved medication safety. So by verifying medicines listings, us as pharmacists can prevent misinformation and guide patients towards safe and effective treatments. In terms of adverse drug reporting, the directory can be used alongside SAHPRA's Med Safety app, and we've already heard about the link with pharmacovigilance. And then the main one, which was always an issue for myself, is the repackaged medicines. We no longer have to try and photostat a PIL or a package insert. We literally can just get that QR code and attach it to any repackaged medicines. And this can be prescription or OTC. Next slide, please. So I believe pharmacists can play a crucial role in supporting the SAHPRA online directly. Firstly, by facilitating public access, we can guide the patients and healthcare professionals to the directory. Pharmacists can help improve awareness and accessibility of SAHPRA registered medicines. And this is especially important in the number of counterfeit and illegal and unregistered medicines that are currently available in this country. And then providing expert insights. So as pharmacists, we can offer feedback on the directory's usability and suggest improvements to enhance navigation and search functionality. Thanks very much.
Thank you so much, Jackie. And a very clear and nicely simple presentation. It was very easy to follow. That's great. Obviously, coming from a pharmacist perspective, that things must be straightforward for the individual. I love the challenges you outlined, and a lot of them, I can tell you, I think of the same thing when I get the patient leaflet information. Even for an OTC product here, in Geneva, I suppose it's a nightmare to read through. So anything that can make that simple. I like how you did your slide with the pros and the cons, and the pros outweighing the cons. And what's interesting, you said, even with the cons, we're now looking at...
We have solutions.
So it's looking like it's really balanced over in favor of the way forward. And of course, the audio is very interesting, and a lot of people would prefer an audio option as well. So look, we've had our great panel presentations. I'm going to look at having some questions now, and we've had some through that have come through, and I'm going to kick off. My first question is actually to Luleka. When is the pilot project planned to commence? Will there be another pilot open for prescription medicines? I'm not sure we need the one on prescription, but anyway, the question is for you, Luleka. Do you want to take that?
Thanks, Greg. I think in terms of our project plan, the pilot should have already commenced. However, there were a bit of delays with the Section 36 exemption, and that is currently holding up the pilot. But we are hopeful that the pilot should commence as soon as this exemption is granted, depending on the readiness of the applicants that are participating within the pilot. And in terms of having a pilot for prescription medicines, looking at the fact that this particular pilot is looking at medications that have a relatively safety profile that is quite good. I think it will also depend on the findings of this pilot. Whatever we then discover throughout the pilot will then inform whether we do want to explore a pilot that then encompasses prescription medicines. Thanks.
Yeah. Okay, thank you for that. But for the information on the timeline, but I thought your comment that, with OTC products are, high impact, but low risk. So that's one of the criteria taking into account when therefore going ahead with the pilot project. I thought that was interesting. Okay, I have a question here for Nicola. please can you elaborate on some of the reasons for not opting for GS1 2D data matrix codes, given there are concerns with substandard and falsified medicines, a point that was actually mentioned by Jackie around the falsified. My understanding is this would be a better option for the future. Nicola.
Yeah, Greg, I'm certainly no expert on GS1, but just to say that this was looked at very carefully by SAHPRA. And at the end of the day, it was SAHPRA's decision. And the COO, who is unfortunately on leave at the moment, so she's not on this call, made the decision. And after careful consideration, and if there is appetite to re-engage and have an alternative discussion, I'm sure SAHPRA would be open to that. But for the moment, this is a SAHPRA decision, and I am not in a position to question their decision at this juncture.
Okay, fine. I don't know if you can read these codes on the phone either. I'm not sure. I'm not an expert as well.
For now, certainly, for now, most phones, all smartphones, you just take out your camera and you can scan a QR code. That is not true for a GS1 code. And again, I'm not an expert. And I really don't want to speak for SAHPRA. I think that at this point, and I see, Michelle, you are online, and you're welcome to give me a shot, and maybe we can set up another meeting with SAHPRA and ourselves and you, and we can have another look at it. But I don't believe that that's a discussion for this forum. Thank you, Greg.
Okay, fine. Yeah, and of course the counterfeit medicine falsifying is a really, really important issue. It's really important, sure. But it's a separate issue.
Correct. Yes.
And maybe it's important not to get the two things mixed up. One is having better information and accessibility for consumers, and the other one is looking at how we can deal with the counterfeit medicines.
Absolutely. Yeah. Thanks, Greg.
Okay. I have a question for Momina. How is access to the uploaded PILs monitored? Are there any analytics available to track how often they are viewed or scanned? So I'm just reading off my screen there.
No worries. So currently the primary goal is accessibility and compliance, but the basic analytics such as the page hits, the views, the scan frequency as well are being explored for future integration. So that is part of the goal and the aims of the pilot as well, is to sort of get those page hits and the scan frequencies and the analytics of who essentially would use an electronic pill, or how often would someone use an electronic pill over and above a actually paper leaflet itself. And this could eventually support insights into patient engagement, also help with PV signal detection, and even inform some sort of health literacy strategies as well. So definitely the analytics are in the background assisting for future support as well.
Okay, thank you. And now a question for Jackie. From a pharmacist perspective, again, sorry, I'm reading off the screen. What do you see as the major advantages of electronic patient information leaflets and packet insert? But you've addressed that in many respects already, Jackie. But I don't know if you want to build on what you've actually said.
Yes, so I think I did outline it. From my opinion, I think there are huge advantages in terms of a pharmacist. We see it where a patient will come in and they've thrown the package insert away. They no longer know how to take the medicine, or we get asked to give them a PIL or a package insert. And I already said to you, you try and photostat a PIL. It's not easy.
Yeah.
And I think the other thing as well that I really like is that you're now accessing SAHPRA's website. So we see online in social media adverts for medicines, which as a pharmacist, I know are not registered in South Africa. And, to try and warn the public. I don't know if you're aware, Greg, but there was a time where children were being poisoned buy foods and in spaza shops and tuck shops and what have you. And as pharmacists, we put out a media release also warning people not to buy medicines unless it's from a reputable source, such as a pharmacy or a dispensing doctor. And people are buying these medicines off the internet, online. And I think it would be a safety check, because now they could actually go and see if that name is registered with SAHPRA. So lots of advantages that I can see. The main ones, as I say, is for those people who struggle with language or can't read or are blind. The audio ones, I think, are going to be an absolute game changer. And I'm very excited to hear about that.
Yeah, and you mentioned a really important thing is for people to be aware of where they're buying their medicines, and you know, if you do have online medicines systems, they should be verified ones. And I know as pharmacists you do a lot of work in that area, so that's really very important. Look, I'll open some of this out. We've got about 6 minutes left. I'd like to open up to any of the other panelists who may want to make any further comments. For example, around future possibilities of e-labeling, around general understanding and information for patients, and the collaborations that are taking place between yourselves. I mean, it's quite clear. The only way to move forward on something like this is a clear collaboration, you know, between healthcare professionals, between the agency and between the industry, and working together. I mean, is the classic way forward. I know there's that African expression, it takes a village. So definitely the case here. So do any of the other panelists want to build on what Jackie said, or take up any of the other points which have been made?
Yeah, Greg, if I may.
Please.
Thank you. Yeah, two things I'd love to add. And the first is that, and Jackie touched on it, is the fact that often pharmacists will use what I term a broken pack. So you put, let's say somebody's on a 3-day course of antibiotics, that 3 tablets or 6 tablets or whatever it may be gets put into a white box, and you've got some sort of label on it with very little information, because that's all the real estate requires. So what we're looking at the moment, and we've engaged with all the pharmacy software companies, is to integrate that QR code using what we call a NAPI code, which everybody, the South Africans on the call, will know what we mean, where you can actually pull that QR code for the particular product in question, and that can be printed on that label. And there's also the ability to either WhatsApp, SMS, or what's the other one, Signal, the code directly to the patient, and also to, if they don't want the actual link to the particular site, the ability to text or WhatsApp the PDF of the patient information leaflet, which I think is really, really cool. And we as you were talking, I was starting to think, you know, maybe there's an opportunity to also be able to WhatsApp that link to the audio. So I think that's worth noting. And something that we've also been chatting about very informally with SAHPRA is the ability of AI, to use AI. And, you know, that could be smart search and filtering. It could be chat box assistance where, you know, sort of AI chat box could answer common queries, guide through the directory and so forth. And then also something that is definitely possible is real-time translation. And yeah, so, you know, it's super exciting. I think we were way off from getting there, and there's a lot to do before then. But it's certainly, you know, I'm super excited about it. I really love AI, and not that I understand it all that particularly well, but I think it's something that we need to look at. So thank you, Greg.
Yeah, well, I'll make a public admission here. that I'm a bit addicted to chat at the moment. So,
are you?
look, I think what you just mentioned, real-time translation, I made a note of it actually earlier, that there are AI systems to do that, which really, really take us, I think, into another area here that could never have been perceived, several years back. And we had an event recently last week. It was the World Health Assembly here in Geneva, WHO, and we held a meeting with the WHO's Be Healthy, Be Mobile, and essentially the conclusion is if we combine self-care and all the solutions and products and applications that we have together with this digitalization and AI, we do have in our hands, and actually in people's hands, a healthcare revolution, because we're able to go places where before we weren't able to go before. I don't know if anyone follows Star Trek down there, the first generation. That was it. So okay, anybody else want to follow on from what was mentioned?
Yes,
just by
Nicola.
Yeah, please.
So, Greg, and I think this is a very important point where you're talking about a revolution. Not only do we need, well, we need a revolution, because if we're looking towards universal health coverage, we need people to start taking care of themselves. And self-care is the future of healthcare. We can no longer rely on a curative model. We need a preventative model. We need people to be taking responsibility for their own health care. And I think by putting this in place, it's going to better enable patients, consumers, to take care of themselves. And I think, again, if I just want to reiterate, for me as a pharmacist, I'm really excited about the fact that package inserts and PILs can be updated more regularly, because you can get a new pharmacist who could be recommending something according to a package insert who wasn't registered when SAHPRA issued that safety alert on dextromethorphan back in 2012, and could be recommending something to a small child, which is a contraindication. So very exciting voyage ahead of us. And I think this fits in so nicely with universal health coverage and self-care.
Yeah, absolutely. And I think I might rob your term. Self-care is the future of healthcare. We do say self-care is healthcare, but I like self-care is the future of healthcare. And indeed, there is this significant refocusing from the treatment to prevention, the preventative model, as you said, and that's definitely been one of the key things being spoken about out here in Geneva. Look, I'd like to give the last word to Luleka, because Sapphire, you've done so much work in this area, and Nicola was telling me that when I first met her back in Bangkok, and she presented about the work here. So please, the floor is yours. The last word with the government, well, with the agency, I should say. Yeah.
I think for us as a regulator, our interest is patient safety. And when we are of the view that when patients understand their medication better, outcomes improve and our systems benefit. So e-labeling in its nature it's not just a digitalization of leaflet, but it's about reimagining how we deliver this information to our patients. And it's an exciting project for us as a regulator. We are really looking forward to it with all its limitations. I mean, everything that we do, we have to test it before we can see if it's possible or it's not possible. We can't sit back and say and believe in the impossible without actually testing in the market whether it is feasible or not. Thanks.
Thank you very much. So very positive final words there. So look, I'd like to take this opportunity to thank all the panelists, to thank the Global Self-Care Federation team, Iofin and Padma, for putting this all together, and all of you out there. I know we had, I think, 100 at one point participants for joining us today. So as we heard, self-care is the future of healthcare, and indeed digitalization, issues like e-labeling are going to be very significant game changers, I think, in empowering people in their own health and providing medicines for the people. So thank you very much, and I wish you all a good afternoon or good evening wherever you are. Bye-bye.
Thanks, Greg. Thanks,
Yes,
everyone. Bye-bye.